Refer to physician's order for type of moist heat application, location and duration of application, desired temperature, and institutional policies regarding temperature. Then, assess the skin around to be treated. Refer to medical record to identify any systemic contraindications to moist heat application. Clients at risk are those who have history of myocardial infarction, angina pectoris, hypotension, those who are using nitroglycerin transdermal patch or ointment, and smoking cessation patches. Then, after that, assess the client's blood pressure and pulse. Assess the client's ability to position themselves. Then, ask if they are feeling any pain and rate it into 0 to 10. Assemble and prepare the equipment and supplies. There are clean basin, solution, absorbent gauze dressing, dry bath towel, disposable gloves, sterile gloves, waterproof pad, tape, and bath blanket. After that, you may continue to explain the procedure and the purpose of the therapy to the patient. Hello, Mrs. Hart. I'm Jerry Johnson Higuit, and I will be your nurse for today. First, I will be checking your physician's order, okay? Then please excuse me. I will going to assess the skin that needs to be treated. Then Mrs. Hart, I'm going to ask you a few questions about your medical history. Will that be okay?
Yes.
So Mrs. Hart, do you have a history of myocardial infarction?
No.
How about in angina pectoris?
Also no.
Did you recently have hypotension?
Fortunately no.
Are you using nitroglycerin transdermal patch or maybe an ointment of it?
No, nurse.
Then do you have a smoking cessation patch?
No, I don't have one.
Okay. Then you are able to do the heat application without any worries, Mrs. Hart. Then please excuse me, Mrs. Hart. Okay. Are you able to position yourself? If
No,
not,
I need
I
your
will
help.
going to help you. Are you feeling any pain or discomfort?
Yes, actually I do.
Can you rate your pain from 0 to 10? 0 being the lowest and 10 being the highest?
I'll say it's 5.
Okay, thank you for doing so. So, ma'am, what are we going today is we're going to apply heat to the body part to stimulate your blood circulation to the injury site. This oxygen-rich blood brings nutrient to the affected area, promoting healing. Heat also helps in removing lactic acid buildup from overtaxed muscles, which allows them to unclench, which means that your wound will heal faster. Okay, Mrs. Hart, I'm just going to close the door. Now I'm going to start doing the heat application. Excuse me, please. I'm going to cover you with a bath towel, okay? I'm going to assess your wound, okay, ma'am?
Feel free to do so.
Okay, thank you. Is this too hot, ma'am?
No, it's just right.
Okay. Okay, Mrs. Hart. Now we're going to leave that for a few minutes and I'll come back later after it is done, okay? Thank
Okay.
you. Wala ako. Okay, Mrs. Hart, thank you for waiting. Now we're going to remove it. I'm going to assess you to a comfortable position. Is that okay?
Yes.
Now, Mrs. Hart, we're going to do sitz bath. Please excuse me. Mrs. Hart, could you please put your arms this way? Okay, slowly. Is the temperature fine?
Yes, it's just right.
Okay, now I'm going to cover it with a blanket, okay? Okay, now we're going to wait for at least 15 to 20 minutes. I'm going to go back again and check it once it's done. Hello, Mrs. Hart. Do you feel okay?
Yes, I feel fine.
Okay, now we're going to remove it, okay? Let me help you go back again to your proper position, okay? Does your wound have a burning sensation?
No, it feels fine.
Okay. Do you feel any pain?
Not as much as before.
That's good. How do you feel after the therapy, ma'am?
I feel good and relaxed. My wound feels fine.
Great! Thank you for your cooperation, Mrs. Hart. I will now be going. You can call for me when you needed me, okay?
Absolutely.
Thanks again.